just as an introduction, I was wondering if you could just tell us about Sharbot Lake Family Health Team, the population and community you serve, and your clinical practice.
Well, I've been in Sharbot Lake. This is my 50th year here. We've been a family health team for I don't know how many, 12 or 13 years, I think. It's sparsely populated up here. We have around 2,700 patients. The north half of the county only has a population density of 3 per square kilometer, I think it is. So we've got the best of all worlds up here. It's beautiful countryside, but we're pretty close to the major centers as well. But it's,
so what type of drive would it be for your patients to have to go to an assessment center in Napanee or in Kingston?
Well, it's about an hour from Sharbot Lake, and some of them live north of here, so some of them would have further than that round trip. And then I understand they may have to be in a lineup.
Great. So as a family health team serving a defined population in relatively rural, so an hour from Kingston or Napanee, what have you and your family health team done to help your patients have access to testing for COVID-19?
Well, we started getting quite a number of calls last week, which didn't surprise us with school starting up. And we heard that there were big lineups in Kingston, so they were facing potentially huge drive and waiting time. So we felt it was important to be able to test them here. At the same time, we were concerned that it could overwhelm our capacity to still be seeing same-day patients for non-COVID related problems. So we decided, Danny Kunick, my associate, and I decided that we'd take turns coming in early or in the day on alternate days so that we could do some COVID screening. And for people that just needed a nasopharyngeal swab, if they needed to be seen as well, then we're working those into the clinic times.
Okay, so it sounds like you're orchestrating it early in the morning, and the physicians at the clinic are alternating the provision of the assessment and testing. So how many patients might you see in the morning and test for COVID-19?
Well, we're just really getting into it, so I don't know how many it's going to be. I've done, I think, about 8 this morning already, 5 of those before clinic, and I've done at least 3 since we started seeing patients.
And what's been the feedback so far, both from your staff and from patients?
Well, the patients are very grateful, as they are about all the services that they receive during the cutbacks and changes in services due to COVID. We've had, virtually no complaints about the changes in service, and in fact that the patients are grateful for the service that they get, and have been very cooperative in terms of physical distancing and wearing masks, and not just at the clinic, but throughout the community in the local stores and businesses. And we see a high level of cooperation.
I think it would be very welcomed from a patient perspective and community's perspective, and I want to thank you for stepping up and providing the testing and assessment of your patients. Any lessons learned to date? Anything you want to tell other family health teams if they're interested in doing this for their patients?
Well, simply to have it well organized. We thought we probably could do one every 5 minutes before clinic if all they needed was a swab, and provided all the paperwork was done. And for instance, if the information sheet isn't ready and you've got to come back in and get it, or tell them to phone in, then you're just creating extra work. So it helps to be well organized and have a basket of swabs that are labeled and in order, and to go out and do them efficiently, because it doesn't take that long to do it. And when you look at the minimal effort on our part to save them that amount of driving, each individual or family, there's no question that we should be doing it.
And in terms of infection prevention and control, have you found any issues? Have you found it difficult to get any equipment that's required for the testing? And anything your local public health agency or partners can help you with?
We've done really well. Maggie Black, our ED, as you know, is a strong advocate, and she lobbies to see that we have the equipment and support that we need. We've had great support from public health. You're probably aware that Maggie's often calling with a question that even though we read the information sheets, it's often confusing. You think you've got it down, and then you come up with a scenario and you're not quite sure. So we're often calling in for a little bit of advice.
Great. Well, I'm very happy that you've stepped up in providing this level of care to your patients. I'm an older physician and been around a long time. You've been around a little longer, I think, and that's why I really want to sing your praises and use you, as usual, as a great example of primary care meeting the needs of the community and worrying about billing later. But just getting things done is always been your approach, and it's brilliant.
Well, country people have to be practical, don't they?
Yes, they do. Yeah, thanks again, Peter. This is just terrific.
Thank you, Karen.
Okay, all the best.
Bye-bye.
Best to your whole team. This is just great.
Thank you. We have a great team here. They've been a great support. They've really stepped up to the plate.
Well, you brought them together. Thank you.
Thanks.
Okay, bye now.